Fishing communities face limited access to sexual reproductive rights information and services, low contraceptive utilization, and planned pregnancies and gender-based violence. These challenges are exacerbated by the remote and often isolated locations of fishing communities, coupled with limited healthcare infrastructure and the influence of traditional norms and practices. Therefore, GIZ Responsible Fisheries Business Chains Project, in partnership with Sector Initiative Population Dynamics, Sexual and Reproductive Health and Rights Program, undertook additional training of 1,898 BDS participants, including 971 females and 927 males in SRH across fishing districts on Lake Victoria. The overarching goal involves integrating SRH into various sectors, including nutrition, rural development, and vocational training. The training sessions covered essential components such as menstrual health, STI, HIV prevention, family planning, gender-based violence awareness.
The biggest training came and they taught us about healthy reproductive system. They told us that we must use what? Pads. And they told us there are two types of pads. There are pads for washing, and then there is pad for single use. And they told us we must be clean.
We were taught how to prevent HIV, stroke, or AIDS. Then, when we are sick, we are taught to go and get treatment. Treatment is there, and if you get treatment, you can live longer and plan for your family.
As we went for family planning, we know that now we mastered that you can get children that you can manage. Are you getting me? Don't produce anyhow.
And so we got a knowledge from there that if you are not in touch with your partner, at least you can get some neighbors or at least religious leaders to counsel you. And from there I went to my community. I counseled the people because I was trained in.
Deliveries also began. They also now, mothers are coming for antenatal and others come for antenatal, they also deliver. And all this is actually hiking the demand. And for that reason, we have already highlighted that facility. It is the Uganda Health Center 2. This facility now to be upgraded to be Health Center 3, and we have opened our doors.
And we believe sexual and reproductive health and rights should be almost like a cross-cutting issue in programs, especially in rural development programs, in food security programs, because in Uganda and in many other countries where we work, the rural population might not have access to that information. They might not have access to the products, the equipment needed. So if we would have this topic, a cross-cutting topic, I think it would be a very, very important thing, and we would have a big impact on the betterment of rural communities where we work.